Katie, I think you're more athletic. So let's bring your knees up just about a half more inch, right there. So you notice we're starting to see a small tremor response in both. So these are muscular tremors, and this deletes trauma. So during this process, this is not EMDR, this is not therapy, this is the body doing its own stuff. We are just making them sure they're safe and teaching them how to get their finger off the switch. That's it. So we're also going to I want to encourage both of you to kind of let those tremors move. If they move into the abdomen or the glutes, let those just completely move where they want to go. And Katie, let's take this up a notch. I want you to pick your butt up off the floor 1 inch, right there, and just hold that. So different people will require different levels of muscular fatigue. We're just going to hold this. I just want you to watch in silence as this happens. And the funny thing is, like Bjoern and I can have a full conversation while these tremors are going, even if this entire body is convulsing, and emotions will come up. Like you saw the Navy SEAL yesterday crying, he was not sad. There's no sadness that happened yesterday. If I could talk about it with Ashlyn, there was massive amounts of tears coming out, but I was joking and making jokes, and we were talking the entire time. And her body was pretty violent yesterday, and it was maybe a little painful. So we're starting to see Ashlyn jumping in. These tremors here, and Bjoern are starting to get bigger. And you see the body has been wanting to do this your entire life. Literally every mammal on Earth has this exact response. So it's a beautiful thing to start seeing this. We're starting to see more of these. And what's funny is, like, none of this is in your conscious control, right, Katie? I just want people to know that the reason I can converse and we can have a full conversation while these tremors are getting bigger or moving around the body is this is not in their brain. This is spinal cord activity. So their brain is free to do whatever. So with a lot of people, you can just go watch Netflix, you can listen to a podcast, you can do whatever the hell you want while this stuff is going on. So you want this relaxation to take place in your body, and then this muscular tension brings these tremors. Just let that go, Katie. So as a practitioner, I'm starting to notice that her tummy is coming upward, which means her low back is starting to get involved, which is great. And the moment, like I see Katie's stomach or her back start to arch a little bit more, I want to put her butt down. Just physics, because she can stretch her lower back more if her butt's on the floor. But I'm going to let Katie's get a little bigger for a few minutes. And Bjoern, let's see if you can just kind of tighten your butt cheeks until it just lifts a little bit. There you go, right there. So you can notice the difference between what you're seeing here and just a muscle contracting. So now the body is starting to release whatever it wants to. And you don't have to like process an event. There's none of that. You don't have to like, oh, go back to the time where this thing happened, or like, I want you to think about this thing. Your body has all that stuff. It's way smarter than us. The spinal cord is a lot smarter than us. That's why none of us would volunteer to say, I'll move breathing and circulation into my conscious human brain, because we would all be dead. We would forget. You'd be watching Game of Thrones and just die. So your abdominal muscles, or Bjoern's abdominal muscles are starting to come in. If you can see the movement here in his lower abdomen. And sometimes, or one of the alternatives we can start to do is, which I'm not going to do now, but maybe bring the legs up. So up into the air, almost like a crunch. But you're just kind of elevating the legs just slightly, a tiny bit of tension on the muscles. Just a little bit of fatigue. With knees bent. Yeah. Keep those butt cheeks tight. So it's funny that you can lift your butt up if you want. If you want. So this is a abdominal activation here, which is very normal. What you want to look for is the head starting, if the head starts lifting, you want to make sure your hands are under there, or you've got a giant pool noodle to where there's nothing. So it costs $2 at Dollar General. You get a pool noodle, a bread knife or something in the kitchen, and just go whoosh. You get a little piece of pool noodle. That's what the military uses anyway, when we went through it. That's fine. So this abdominal activation here is what you're seeing. You're seeing her shoulder starting to come in. I would automatically assume that there's some memory associated with doing something with the shoulder. It's not important. You're not sitting here, oh, tell me about this time. No one gives a shit. The body knows what it's doing. But I'm just thinking that, I'm processing that mentally as I'm seeing this start to come in right here. This is not her consciousness at all. So once you start letting go, the body starts reacting all on its own and processing this information. So a lot of times the spinal cord, so you can see Katie's eyelids moving. This is not conscious for her. You can see her lips and chin moving back and forth. Teeth chattering is a very normal thing that happens. You did it yesterday, almost to the point of pain. Well, your body did it for you. So we have abdominal moving, then it's kind of moving up to the shoulders. These shoulders are rounding out like this. This is a very normal and perfect release. You see Bjoern is also starting this little bouncing movement, and we can see that people process stuff differently. So the spinal cord right now is kind of searching around the body. It's scanning Katie's body to find things, and it's running through and processing one thing at a time, as far as we know. But as far as I've seen them doing this hundreds of times, it'll go to where it needs to go, and it'll relax for a minute, and then it'll kind of test that area to see if it's done, and then it'll kind of, you can see the muscles ripple until it finds a new area to start working on, and then it works on that for a few minutes, and then it starts moving somewhere else. But this is like an experience that looks like it takes an immense amount of concentration. You can't talk to them. We need complete silence. But Katie is perfectly capable of conversation. Describe how it feels for your body to just do that on its own. Can you?
Yeah, it feels like it does. It feels like it scans and then it finds something, and it feels like it's practicing. It feels like there's an alien in your body that's like practicing the same movement over again, but like slight variations. And then when it's very clear when it's done practicing, and then it's like, okay, and then it tests it a little more, and then it moves on to some other part of your body.
Yeah. So this movement here, this downward movement of the shoulder, this is the only time I've ever seen somebody in pain during this, is if it happens a whole lot. This is the scapula muscle back here, the shoulder blade kind of retracting and moving inward and down. Very common. So sometimes if someone has a lot of shoulder trauma, and you can see her arm is pushing down to the floor, everybody can see that? That may indicate that later on I might roll her on her right side and just hang her arm behind her like this, to where the arm can move back to where it needs to go. I had a client who had shoulder surgery, and now that he's able to do it, he's going to bed and his arm, he's not even trying to do it, his arm starts going and then going up, and he lets it go and just it stretches itself out and fixes itself, and he was pain-free, I think, within 30 minutes after 5 years of pain. Nothing that I did. No credit to me whatsoever. This is built in to all of us. So let's go back to Bjoern here. We're seeing some of this movement here. So Bjoern, what I want you to do is let that grow as much as it wants to. You can see this bouncing movement. Once that starts, I want you just to think of something completely different, or just kind of go somewhere else in your mind and let that grow as big as it wants to get. So this is some really good core trimmering that's happening here. Nothing about this is conscious. This looks like an exorcism over here. With the teeth. Let that go. In many regards, in the Webster's definition of what exorcism is, this is an exorcism. Like stuff is being exorcised or removed from our body. Yeah. Ashley says it feels like being wrung out. There's a microphone. After a hot sauna.
Use the mic, talk.
So Bjoern, what I want you to do
When I
is
talk to also, put the mics there, and also
The other mic's behind you.
take your pelvis, like this pelvic bone, and then tilt it this way to where you're kind of arching your back, right there. Now hold that for just a minute. I'm going to stretch those abdominals out just a second. So they've got some space. And there's nothing technical about any of this. I'm making it up as I go. I'm just dealing with what I see. So the abs start jiggling, abs start wanting to contract. I'm going to stretch them out for just a minute. And now the next thing, now you can tilt your pelvis the other way. So like you're doing a pelvic thrust. Now hold that for just a second. About 30 seconds there.
So is the idea to try and get different muscle groups to start fatiguing so that the nerves wake up?
This is when you would want to continue fatigue. This is when you would want to let it go.
I love this. Everybody wants to be helpful.
So really quickly, what you're seeing here is most likely a memory. I'm almost guarantee you she's not conscious of whatever memory it is. Katie, no? Okay. So this is some memory that's in there, outside of her awareness, maybe from childhood, and there's something there where this was the action that happened during that moment. So this is very normal. It's triggering all of us to say, well, I need the help. I can see it in some of your subconsciouses, especially the empaths.
Nah, just myself.
So this looks conscious, right? This kicking thing, she's not doing that. I guarantee you she's not doing that. Now, Katie, since you're both of your abductors are coming in, Katie, go ahead and roll back on your back, put your feet together. There, let those do what they want. Space is important.
Chase. So with David's magic frame technique, part of that trauma release or what you do, you also reframe the memory. So with this, it's all the body doing it. So what about reframing the memory? Is that, are you saying whenever they need to do that, the body just lets it go and they just won't think about that again?
A lot of your memories are in your mammalian brain. Real hard to get down in there. This is down in there. So that's why there's nothing conscious about any of this. So there's nothing being reframed. And usually after someone goes through it, especially for the first time, you can just do an interview with Ashlyn and let her come up here and answer all your questions, how she feels, what it was like, how was her sleep last night, whatever you want to know. But right after the session yesterday, it's like 1,000 pounds were lifted off of her. And it was very transformational. It's amazing. It's something you can do every day.
So I'm curious, Katie is experiencing a lot more body twitching, moving, releasing of the memory. Bjoern is not as much. It's almost like he's holding back or holding it in You said it's not a conscious thing, so he's not consciously holding anything in.
It just takes time. A lot of people take half an hour to get to that point. And then once you find that little switch, the whole body can go instantaneous. I can turn my leg on in a tenth of a second and just let go of that one little part and it starts going. But it just takes a while, so some people are a little closer to finding where that switch is at. And granted, Katie has done a little bit of work like this before. Hopefully this is a little more dramatic. So her low back is starting to get involved now. So Katie, you can bring your knees up and just kind of put your feet on the floor, right there. This is normal physics. There's no trick there. I just wanted her to be able to pick up her back. And it's really hard if your feet are together like that. And Bjoern, if you want to do the same, you're more than welcome. Just kind of just put your feet on the floor. And just kind of just bring that tension back into your butt cheeks. Right there. Wash your face. Walk out here with a bloody nose.
So we get the trauma out.
So this is like part of her body just wants to do this, so Katie is allowing her body to do that. Does that make sense? So this is not like, oh my God, I can't control myself. This is her letting that happen. And maybe some of this was assisting her body. She knew that there was a twist wanting to happen, so Katie might roll over a little bit to help that start to happen. So you can see these big heaving abdominal movements that are happening right now. It's very normal. It looks like somebody might vomit. It sometimes feels like you're going to vomit because stuff's coming out. I've never seen anyone vomit during this, but I've seen people pee. I've seen people fart. I definitely farted the first time I did it. Really big.
Now you're telling us.
Okay, are these traumas?
Mike,
There's a button.
push it till it's green. Push and hold.
Oh, no, what's green? This one's a little.
So we're starting to see a lot of, you remember we're stressing the glutes, right? Which is where we would expect to see the tremors, but now the tremors are coming into the low back, abdominal area, and into the abductors, which you see here in the thighs, which is great. But Bjoern, just let that grow as big as it can possibly get. The more you can just kind of take your mind off of that and let it expand as much as you want.
So do we know if this is physical trauma or emotional or a combination?
No idea. They probably don't either. It's just deleting whatever, it's really like the admin user of your body. So I think it knows more than we do. So we really don't know what trauma it is. It can do anything. So even emotional, psychological trauma can go away through TRE as well.
Yeah. So logical follow-up, would you suggest that we all do this as a therapeutic?
100%. Yeah, 'cause it's built into us, yeah. Do it whenever you want, whenever you can. So it's funny, like, we want to like, oh, maybe I shouldn't talk to her right now. Katie, how you doing? You look like a witch.
She's a demon burner!
So it's amazing that the brain is not involved in a lot of this. So Bjoern's still kind of getting into the process of pulling the brain out of the body. Katie's already gone through that process, which is why I wanted her to come up here. Just because it would be a time saver and you'd be able to see this contrast between finding a switch and then finding a switch even harder.
Have you seen any research or anything correlating this between this experience and possibly why people seize?
No. But I am a neuroscientist, and seizures are a wildly different activity than what we're seeing here. If you have like a seizure or any kind of trauma in your spinal cord, you're dead instantaneously. You'll stop breathing.
Okay, thank you.
So don't do that.
Great question. Wonderful question.
You can see it? Yes, you can see it.
This looks so similar to people that I've seen on ayahuasca. It's just like, it takes away the choice point.
Yeah. Well, ayahuasca is just letting you do what an animal does.
You see the same kind of patterns in aspects of network chiropractic where they actually trigger the spinal cord to start releasing spontaneously and let people twitch around. Also, there's a practice in a lot of the Qigong systems called spontaneous Qi movement, which is a lot like you just let the body do what it wants to do. And so there's analogs everywhere.
Let that go, Bjoern.
Fine.
Don't try it. Just stay here with me and let your body go somewhere else.
Just feels like a lot of muscle pain.
Are you very athletic, Bjorn? No.
That's a genuine question.
That, I'm saying that because if your muscles were already used to being worked out, it would take a longer time to get to that stress point.
So Bjoern, let's go back to stressing the abductors with your butt on the floor, feet, soles together with your feet, because your abs are really starting to come in now, and this is one of the best ways to do it.
This?
Yeah. So typically what you'll see, 99% of people that I've done it with, is this abductor flexion is one of the fastest ways to do it. The more athletic they are, the more you're going to need to stress their muscles, not through working out, but through stillness and fatigue. Just because it helps the brain to let go. And this is absolutely normal. So a lot of people will stay on a yoga mat and just kind of have everything happen there. Some people will need to twist and turn because some of these muscles back here don't really get stretched out on a yoga mat unless the person's like twisted and turned around. And Bjoern, just trying to bring a tiny, like a micro piece of tension into your abdominal muscles. Just a tiny bit of tension. Yeah. So as a secondary, if you would like to help someone do it a little bit faster, it's just kind of encouraging them to simulate a tremor. So like I'm having sympathy tremors, like my butt cheeks are going crazy. But to simulate a tremor down into the glutes. The glutes are the easiest, and the glutes and these muscles back here, quads, I think. Hamstrings. Easiest to start the tremor process in and simulate the tremor. So all of us can kind of repeatedly jerk one of these muscles and then tell the brain that's completely fine, let that continue happening. So we're starting to just give the brain, what does persuasion start with? It's all permission.
Jason. So getting into that abductor area and that lower area, I don't know how accurate it is. I've heard it said that the psoas area holds like a lot of tension and stuff like that. So is that like what would be activated there? Is that like where that's all starting?
Where we store a lot of tension?
Yeah.
I think it's just because the pneumogastric nerve kind of goes all the way down there and basically terminates in a little circle around your butthole.
Delightful.
I think that's the medical term.
That's a technical term.
Or the Las Vegas nerve. So in a TRE session, we've been doing this for 15 minutes.
24.47.
Okay. So we continue. Some people have smaller tremors and they get bigger over time as they continue to practice. So keep in mind that she's done, I don't remember what you called it yesterday, jiggly work?
Trauma shaking?
Trauma shaking. So she's kind of found the switch before. So what I would be doing with Bjoern in a one-on-one session I despise using the word practitioner when it comes to this stuff because I'm doing nothing. Yeah, facilitating or helping. Is to continue to encourage this for about 45 minutes, and there is a massive amount of progress here for a person that's very much just starting. So we're seeing a ton of micro tremors. I don't know if you can see it from further away, all around the sides of the abdomen. The low back is starting to come in. If you can see, kind of he's raising that, most likely not on his own free will. Bjoern? Okay. And then we have these tremors starting to come in here, which are muscular
The
tremors.
shaking is not intentional backwards.
Okay. So this is the tremor here. This is typically how your first TRE session with anybody or yourself will start, with abductors moving into abdominal here in this region. And this is where the brain will continue to stop it, and then just encouraging them to keep this muscular tension, let the tremors start happening, and letting that completely go, letting everything completely do whatever the hell it wants to do.
So Chase, at any point they can stop this, right?
Instantaneously. Katie can just stand up right now.
You want me to?
You're good, just keep going.
Check out your left. So somebody that has like back problems or this type of thing, I'm assuming the brain knows not to hurt those areas, so there's no worry of doing additional damage.
I won't guarantee anything.
Okay.
That's your spine, or it's that person's spine. And sometimes people will stretch and hurt the area they're doing because it's trying to contract and massage those muscles around an injury or around a pain spot so they can be released later. But like sometimes if there's a back injury or back problems and the person's bouncing like that on the floor, it might not be, jab a pool noodle down there.
Would a bed work?
Yeah, you can do it anywhere. I mean, the zebras do it in the middle of like a mud pit.
I don't recommend it unless there's subway.
I was going to say the hotel lobby, bad idea.
Unless it's crowded, then nobody will hook it.
Really quick.
You mean they do it spontaneously? I thought they have to have trauma. They do it.
Who's this?
You mean the zebras
Mike.
do it
Don't step on the cushion.
You mean they zebras do spontaneously? I thought it was just at the trauma.
No. You'll see animals do this little twitching tremor response for 5 seconds, 10 seconds at a time, all the time.
Really?
Or maybe once a day or something like that. But typically the big, wild tremors are immediately following a trauma when our body really wants to do it real bad. So all we're doing with the TRE is just letting the body do what it's been trying to do for a long time. The worst injury I've ever seen with TRE is someone kind of kicking like Katie is right now and breaking my toe.
Got a question.
So one thing, microphone.
Number two.
Microphone? Okay.
So you can see that everyone's body, so Bjorn's tremors are most likely, his shoulders still haven't kind of come into this, his chest hasn't really started coming in. So if I have a client that's like Bjoern, and Bjoern, I'm talking to you. So what we're doing here is trying to exaggerate the tremors. So if you feel any bouncing, I want you to just start exaggerating it and letting it become more pronounced.
Give me a different position for my ankles.
Okay, so put 1 foot flat on the ground and put 1 foot straight out, right there. That should be more relaxing.
No, it's the outside leg. And then just
Chase. With Mike?
Chase,
do dogs do this sometimes when they're sleeping?
Yeah. All animals will do it all the time, just random moments. So like a dog might have a dream about like getting bit by a snake or something like that, and they can just kind of go through this inside of the dream. Especially if you're seeing muscular ripples go from one section to another section of the body, that's typically after a little imaginary trauma that they had. Dogs learn to suppress it if they live with humans. That's why you'll see depressed, domesticated dogs that like, oh my dog needs to take Valium today, or I get my dog's CBD oil. You'll never see a depressed wild animal in your life. Because the dogs learn to suppress it because it looks unusual to us. And I'm not saying as they're growing up, I'm saying ancestrally, a million years ago when we started domesticating that animal. And the fastest animal in the world to be able to be domesticated is a possum. Faster than a wolf or anything. A possum can be domesticated in 4 minutes. And the moment that they're domesticated to humans, they stop all trauma response. They stop all tremors. And then a possum can become depressed the moment it's domesticated.
Wow. So then it no longer plays possum.
Yeah.
So, I've had experiences just randomly throughout a day where I'll feel like not just a chill up my spine, but like the whole body kind of going like this.
So Bjoern, that's not muscle fatigue right there. That is some tremors actually starting, which is fantastic.
About time.
It takes most people longer than this. So it's typically 30 minutes to an hour for a lot of people. So we're kind of at right at this 30-minute mark. You can see Bjorn's little back is starting to come in. That's definitely involuntary. And a lot of these little bouncing moves are fabulous. And so this is kind of the first signs that you're seeing, the beginnings of the body starting to get excited, like the spinal cord is saying, holy shit, I get to do my thing. I get to actually fix all this shit.
I do feel like I'm fine.
This looks like performance art. You know, it's like somebody walked in here, they're like, oh shit, I'm leaving.
I said I do feel like I'm cramped in the back of my thigh.
You can change it up, you can move around. Look at Katie.
I'm trying to disconnect.
You know, there's no need to disconnect. You can connect all you want, it's just allowing it. You can be fully connected to it, but just letting it do it. And once you're experiencing the body kind of do what it really wants to do, and be able to just let go.
I see Katie's fingers are twitching. What happens with the fingers?
With what?
The fingers.
Whose fingers?
Katie's fingers
Squeeze it.
twitching. So is that related to a memory? Or?
Yeah, but the fingers aren't what's twitching, it's these muscles right here. Like, you know, when someone's massaging you and pulls the fingers down. So it's all of these that are pulling in. So maybe grabbing something, who knows. Definitely none of my business, and Katie doesn't care either. Neither does her spine. But I would say, yeah, there's definitely some memory associated with that. So the more often you're able to do TRE and you encourage or walk someone else through the experience, the easier it's going to be to, make more massive tremors start to happen. You'll get to the point of being able to do what Katie's doing. And I'm telling you, there is no prescription drug in the world that feels like how you feel after like a TRE. It's incredible. It's like Xanax minus stupidity.
So, can they do this while standing up?
Yeah, I could stand up and make my leg tremor anytime. Yeah. You don't have to do There's no set maneuver, there's no set rules about anything. It's just laying down is the best way to start finding some of these responses, because everything's able to tighten up. Or loosen up. I guess both.
Hey Chase, is this only for, is this typically used for people that experience physical trauma as opposed to like,
Anything.
like depression?
Anything. So the body keeps a whole bunch of stuff in there. We don't know what it is. But like if you're having trouble, somebody like says like, I can't sleep at night or, you know, something like that's going on, you just send them through like a little TRE thing, let their body start doing. So this rhythmic thing you're seeing right here, just it's happening now for Bjoern. And Bjoern, don't pay any attention to it, let that shit go.
It's the first time it's happening without me
Yeah.
tracking muscles.
So this rhythmic thing here, it's a funny feeling. Can you describe how it feels?
Mike.
Microphone.
It's totally involuntary and just, it's weird because you're thinking about it and like, obviously if I were to get up, I feel like I could stop it.
Yeah.
And I've experienced this once before. I told a couple of people yesterday after a bear went through our campsite at like 2 o'clock in the morning, and once Mama Bear and the cub was gone, like for the next hour I was just shaking uncontrollably.
Wow.
And couldn't fall asleep. Like I was thinking it was just adrenaline, but I was like on the floor in my sleeping bag.
Wow.
So, Chasey and David, I noticed like the beginnings of this one time in a trance state. Like, is that?
Yes.
Have you seen that before?
Yes, all the time.
But I think I suppressed it. No,
Because people don't understand what it is, they don't know what happened. That's why, and when I do self-work, I do a form of internal, where I move my mind to a particular point of tension. As if you work deeper into it, you will start to spontaneously trigger these same kind of waves and clenches and things of that nature. There's been hours in the I'm doing my self-work, and that I was like a break dancer for an hour and a half. You know, and it just, there's different ways to get there. This is a very simple way, a very direct way to do it, just through muscle fatigue. But the idea is the body's pinging, it's looking for a place to sleep, it's called tension. I think the Soviets call it sensory motor amnesia, where you block a case of tension in the body somewhere and kind of forgotten about it. And as the body starts to work through these things, it gets released. And at this level, and I think Chase will agree with me, there's really no distinction as far as the body's concerned between a physical and or an emotional trauma. It's all data that's stored
Yeah,
in
the body didn't go to school.
and there's all the same shit. Right? Spinal cord doesn't make a distinction between what you imagine and what happens to you. Microphone.
Katie might know this actually also, but it sounds like what people talk about like kundalini. You know, they describe it as like a snake unraveling or something in your spine. I wonder if they get so relaxed that this happens automatically.
I honestly can't remember kind of one way or the other.
I think it's just, we're trying to name it, you know, that's our first instinct is, I want to name this, I want to figure it out. But the animals don't do that.
Mike,
Like
please.
our attempt, somebody is like, oh, it's a kundalini.
Yeah.
It's just your natural body.
Just doing this thing. I'm from Arkansas, so I try to keep everything simple.
The sensation is a lot like that. It's you lose total body control, and you lose total days like there's that practice of the breathing.
I couldn't hear a single word.
It feels super similar to like the if you hit like that kundalini breathing and pressurizing cerebral spinal fluid, and you feel that like it's very much like that. Like you need to not be standing as a full.
Pressurizing CSF.
I think it's I forget how to explain it properly, but like the way you're breathing and you're tensioning your muscles, it's like creating tension and pressure, increasing the flow rate and the exchange of cerebral spinal fluid. Is how it's explained to me. could be wrong, but that's how it was done.
I don't think we can change CSFP without a lumbar puncture. Pump some air in there. Oh, we have a doctor in here, I think. Doc?
Brian.
You.
Asking me a question, like I'm an orthopedic surgeon.
Oh, sorry.
And for our Zoomers, can't hear you because you don't have a microphone.
So as a physician, I would say I'm an orthopedic surgeon, but you do study the spine some, and I would have to say that I don't know the answer to that. I don't know whether that's true or not true, but I do meditate, and I do notice that as I'm meditating, I get to higher and higher levels of consciousness as you go up from the base of your spine to the top. You notice a different level of physiological and psychological relaxation. And I think some people interpret that as the spinal cord fluid being pushed up to the pineal gland and changing the secretion of the pineal gland. And I don't know where I heard that. I heard it on a YouTube video, and I don't know what the physiological basis is.
You can't believe anything you see on documentary.
Yeah, I know. That's the only place that I can trace that back to right now in my memory. I've never heard that.
Wow. I did 2 years worth of exams on cerebrospinal fluid. I've never heard of it changing.
I don't know that.
But I'm happy to say I have no idea.
I would think with the disc herniation it's possible. I think with external pressure on the spinal cord, it could increase the pressure internally in the fluid somehow, or at least theoretically it could. Or external pressure on the spinal cord, or if you have a brain tumor,
Yeah.
it could elevate the pressure internally. But I don't know if you could do it purposefully.
That would be interesting to find out.
So, it's not on. So in the wild, our zebra and our gazelle here would spontaneously stop their tremors, get up and run back to the herd. For us human types, will they spontaneously stop eventually, or we just let it run ad infinitum until they're done?
It's usually about, if you want to just let somebody keep running it, it's about 45 minutes.
We're at 42 now.
Yeah. So the body kind of like finishes up. You see like it's kind of rolled her over there. And it's just kind of running through this final process. The abdominals are usually kind of the ending part of what I've noticed. The ending part of this. And you'll see maybe one or two more scans, typically, and I'm not saying every time. But once it's done, it's just kind of flops down. And then with somebody with a lot of trauma, they might have a half-hour break and they can go right back in if they want to.
Moss. Mike, did you want this? And this to Moss, please.
Talk to the mic.
Yeah, so when we did your thing yesterday, there was like pools of sweat everywhere. And I'm shocked that everybody's different. I think there's stuff coming out of the body and we don't know what's going to come out. So you had emotions come out, you had sweat come out, but you were crying. Yeah, your cheeks were really tight in your neck. And I had to do something to her neck yesterday because she kept trying to reach up and it was really painful. So I put like a little towel thing under her neck and then kind of pulled this way just to get some extension out of there. Well, you can let this go as long as you want it to go. I just wanted you to see it and watch a person that's brand new and a person that's had a little bit of experience. You can see how we can transform everything about our lives and just let the trauma go. Because we tend to think, I need a complex solution to the trauma. Like, I'm not going to do what a grizzly bear does. I need some really advanced shit. Even though the grizzly bear has a 100% success rate, and psychotherapists are about 61%. After 12 years.
Okay, right. So, Brian, what you were saying,
Mike?
So in that scenario that I was talking about earlier, where I was essentially lying in a tent and just getting through the experiment that bear, I didn't feel like I was able to stop what I was doing. Could I have done that?
Yeah. Because if the bear came back, your body would completely stop.
So Brian, what you were saying about external pressure, and again, I don't know the accuracy, so just have it explained to me. With the breathing process, you're holding the air down, pressurizing it very heavily, and slowly tensing the muscle like you're catch-up tubing yourself, surrounding the spine with like as much air as you can more or less hold out, like in harmony with squeezing, very slow, pressurizing up, tensing all the abdominal muscles, like as though you are being exposed up from the outside and slowly moving up. And you feel an incredible amount of pressure in your head by the time you're done with it, like you feel like you're gonna pass out.
You have to understand, like, your spinal cord and your brain, it's encased in bone, which is like really hard. And so in order to externally pressurize it, just from your abdominal pressure and your external muscles, probably would be extremely hard to do that. Plus it's spongy. So when you try to pressurize something that's spongy, it just absorbs the force, right? And so I'm not sure what the mechanism is exactly. I've heard like Joe Dispenza talk about it and things like that on videos, but I don't know what, he never talks about how that happens physiologically. And so I couldn't tell you for sure whether it happens or not, or how it was measured. If he measured it somehow, because like Jay said, you'd have to actually puncture the spinal cord, or you'd have to do a lumbar puncture to get into the CSF. So there is some CSF that's external to the spinal cord down at the base, but it's still encased in bone. And so I don't know if increasing your abdominal pressure would increase the pressure there. It just doesn't. You know, just from what I know, it doesn't make physiological sense that it could do that easily. So.
Yeah, I think if that was the case, you'd give yourself a subdural hematoma pretty quick. Or if you could increase ICP, then you could also give yourself a subdural hematoma. Those would go hand in hand. ICP is intracranial pressure.
Brain swelling.
Or ideal customer profile. According to Bjoern.
Starts from where the feet are, goes up the legs, and then the hips.
Don't whisper, Ashlyn. Speak big into the mic.
Thank you.
Thank you.
So I was just noticing that even when it happened to me, I was already kind of doing it. My body just needed to do it, but it seems to start from the bottom and work its way up. You see that's about accurate?
Yeah, about half the time.
Half the time?
Yeah.
Thank you.
I think everybody's different.
So is Seth doing it too? Because I see his legs like shaking.
No, Seth just twitches like that all the time. It's okay. That's normal, Seth.
Seth just has to pee. So, there's only one proper way to end a TRE session. And I'm joking. You can do whatever the hell you want. This is a very simple thing. There's nothing mystical about it. You just stand up or you finish up when you finish up.
Do people who have nervous tics by any chance? Is that like a subliminal, subconscious, I need to do this kind of thing? Like, people who have repetitive movements or do repetitive?
No, those are typically brain behaviors. So any repetitive movement like that is some kind of a self-soothing behavior. There's nothing self-soothing about this. This is kind of a trauma release. But it is probably very soothing. A lot of people refer to it as an autonomic massage.
Relaxing to watch.
What's that?
It's relaxing to watch.
Yeah. And I mean, like, you have the best sleep of your life doing this stuff. Your PP will be dark, most likely. No idea why. maybe some demons or something going in there.
Demon gate.
It's a problem.
Demon urine.
David, what do you think about nervous tics?
What do I think about nervous tics? Yeah. There's a lot of reasons why you can have a tick. Brain, of course. You could have electrolyte imbalance. You can wrong potassium and sodium. Causes just spontaneous muscle twitching. A lot of reasons why you can have it.
I was just gonna say that I finally feel like fully relaxed and it's still doing it. Whereas before I felt there was always a muscle that's somewhere going, I'm going to go into cramp soon.
Yeah, but this is all your body, right? Not you?
Right now it is. That's
Yeah.
why I feel like I'm finally relaxed.
Yeah.
So it's interesting that some patients, when they're coming out of general anesthesia after an operation, will do this exact same thing, and I don't know if it has something to do with the anesthesia or whether it's this phenomenon that's happening.
I would venture to say that it's this. It's just like the polar bear coming out of that, you know, the trench.
Dark.
I mean, it's pretty violent too. But they're sedated while it's happening, so we don't know if it's, I mean, I think anesthesiologists think that, you know, they need to, give them some more sedation while they're doing this or something so that they don't notice it, but I don't think anybody's ever studied it.
That's actually happened to me. I got put under effort for a bit, and when I came out of it, I started convulsing. I was trying to climb out of the thing, and you're like, what are you doing? Stay down. You know, but I was like panic. Well, I was panicking. It became panic. I was trembling, and I didn't know why I was shaking. I didn't know what I was, and I started panicking. So, yeah.
I think Katie's head's probably good.
Chase, did I hear you correctly that your PP will be dark? Is that what you said?
It's common, yeah.
So the body loves to hold on to things, including toxins, and that's what accumulation things wants to try to get at. So, maybe some of this is just the body, the nervous system saying these. I don't really know, but it seems to make sense.
Yeah, I bet it is. I'm sure it is some kind of toxins.
It may be myoglobin, like from the muscles, so like it's like
Lactic acid buildup and stuff like that. Talk about it too.
Red wine from last night.
Red wine,
So
myoglobin.
people can actually, if they go into kind of certain violent seizures, they can release myoglobin into the blood and can change the color of their urine. It actually fog your kidneys up too, but coming out of the range.
What about the kidneys?
You can get something that's similar to this called malignant hyperthermia after an operation, like after anesthesia, and people can release a massive amount of myoglobin into their urine, and it can actually clog up the little capillaries in the kidneys, cause acute kidney failure, that can lead to chronic kidney failure. So it's something that we're always watch out for. It has similar symptoms to this, and so, yeah.
Consider as a preventative or something that we do before that.
Well, I'm not an anesthesiologist. I'm sure they do something. We interview people. It's a genetic problem, and so we interview people about having a history of this malignant hyperthermia. But it's maybe this thing on steroids is what
Just
happens.
pull the table out of the way.
Temperature
Pull the table out of the way.
There goes the room. She can move. She can definitely move on her own, I promise.
I just don't want her kicking the table.
So is it possible to do this when you're sick? Like those
I would advise against ever doing any of this with a person if you're having someone with TRE and you're a professional. So just BTW. Sorry?
Is it possible to just, for your body to just randomly do this while you're sick?
There we go. Oh, you're sick?
Yeah, I remember a couple times when I've been sick and just break out into shakes and pass out.
Yeah, that's probably what that is. Some of that shaking.
Surrey.
There's so many things that can cause it, But a lot of these things that are unconscious that move around the body like this, I would say usually if it's moving from one place to another, that it's some kind of a trauma thing going on.
Well, yeah, I mean, for me at least it would make sense because it was uncontrollable and it wasn't chills, it was the whole body just quaking. I would pass out, the next day I would start feeling better.
Wow. I would ask the doc here, I would just fall to the person with the degree.
You know, I think it could be a lot of different things, like when your body temperature raises from a fever, you can start to have, your muscles can start to metabolize.
Underneath the camera is a squeeze handle. If you squeeze it, it moves.
Or it could be this. You know, I don't know for sure, because I'm not even sure what this is yet. I'm fascinated by it, you know, like, and it's making me think about so many different things. Well, physiologically and energetically, yeah, definitely. I'm trying to figure out where they meet, you know, and I still can't figure that out. I guess it's not for me to know.
You just have to do it.
So we know what our homework assignment is today, huh?
Hopefully, yeah. I would hope that everybody could do this.
You don't need to use the echo technique. You get people to talk to you
All this
So this is really common here when there's any kind of stuff going on kind of between the shoulder blades and the back. This kind of pulling movement with the pelvis moving that way rhythmically is pulling the skin back here on his back. So it's stretching the muscles there under the skin.
Yesterday when I started to sweat with my tremors on the wrist, I started to do kind of like almost like a side-to-side body rock, like a self-soothing kind of, rocking almost, and then it would start to pick up again. Is that like, do you think that has anything to do with like programming? This kind of thing?
Might be. I think it's just kind of searching and just kind of testing out the muscles to see if it did its job, just to make sure. Yeah. Absolutely. So there's nothing mystical. This is just nature.
Katie's doing that. It almost looks like a 2-year-old having a temper tantrum. You know, like, you ever see a 2-year-old just lose it in the mall or something like that? And it looks like that's what, in a lot of ways, that she's doing.
Yeah.
So if you were doing this at home and say like you knock over the wine rack, the guitars and the TV, and you just get up and like move to another spot, you just kind of repeat this again.
Yeah, you go right back to it. So like Bjoern could stop it and start it. Now that he's kind of got this switch, you can stop, get up, go lay down, and start again.
Okay. And when we started, it seemed a little bit more formal with put your heels together, do this and all that. And you were saying that the more you do this, the more you can turn that switch on. I mean, you were saying you can stand up and have it.
Yeah. So yeah, the more you're able to do this, the easier and faster it is to access this kind of little tremor thing that's going on with us.
How often do you do this, or what makes you want to do a session of this? Like what happens in the environment?
The thing that makes me want to do it is how good it feels. It's better than getting like a deep tissue massage, because the body is giving itself a massage in all of the deep tissue that you never get massaged. So So it feels extremely relaxing. You sleep better. You're more clear and calm throughout the day. Trauma, whatever trauma you have, there's traumas we don't even know that we have. You know, there's so much crap that's stored up all around our body. So it gets rid of everything, and then it feels great. Psychologically, it feels great, and physiologically, it feels great.
You've mentioned in some other videos about ancestral memories. Is this something that might help with maybe past traumas that have been passed?
No idea. I know it clears people up big time. But yeah, our ancestors can pass down memories, not just like a million years ago, but like your great-grandmother could have got her leg chopped off by a train, and you could have a train over. That is proven. That is well proven. No, I can't remember that guy.
Chase, if you didn't have a time limit,
That's 1 hour.
just let it go till the body just stops.
Yeah. And the spine will just kind of shut it off whenever it's finished. I mean, it's a superior creature. I mean, the spine's capable of 5 million times more than we are in terms of control, concentration, thought, and responsibility. It's a lot more responsible than we are.
So Chase, you said that when
That's 1 hour.
like dog owners, they give their dog medication. So if I do this and let my dog see this, will he start?
I don't know, I'm not a dog trainer, but maybe. It's definitely worth a shot.
And then I had a pit bull puppy, and I used to see him shiver when he was sleeping. Is that a tremor?
Probably, yes. And they stop as they get older. Katie, how you doing? Your spine all done?
I could keep going for all day.
Yeah.
I don't know, it's like in class starting.
What's that?
Is class starting here?
Yeah, I think we should. Let's take a 10-minute PP break before we get started. Bjoern?
How often do you do this?
Give them a hand, guys, please. All things